Hello, everyone, and welcome to another episode of Convo with Champions. And this is also going to be another discussion on health issues in Ghana. And today, I'm privileged to have with me a very fine gentleman who is a medical practitioner. I will allow him to introduce himself, then we pick it up from there. Hello, welcome.
Thank you.
Kindly introduce yourself to the audience.
My name is Vincent Bizo Nachnab, and I'm an obstetrician gynecologist. Obstetrician and gynecologist. You know, for my specialty, a lot of people sometimes mix it up. Most people call us gynecologists, hence taking away half of our job. But we are obstetricians and gynecologists. So obstetrics has to do with a pregnant woman.
Okay.
And then the gynecology has to do with a woman who is not pregnant.
Okay.
So per my specialty, say 98% of my patients are female.
Oh.
And I only get to see
That is
a few men. Yes, so depending on where you sit, you will either see it as something good or something bad.
Okay.
Yeah. And then I also double as the divisional chairman for Ghana Medical Association, Western Division. So Western Division comprises, we haven't divided ourselves into 16 regions. We still remain 10 regions. So
Okay.
being the chairman for Western Division means it encompasses the Western North region and then Western region.
Oh, okay.
So
Okay.
that's who I am.
That's great. That is a huge responsibility on you. But let's talk about obstetrician gynecologist. You said obstetrics has to do with pregnant women, and then gynecology is
A woman who is not pregnant.
pregnant.
Issues related to their genital or their reproductive system, their genital tract or their reproductive system.
Okay, okay. Now we hear a lot of magic happening in with women and pregnancy, where you are doing this what we call artificial insemination or something.
Yeah. So broadly, it is called assisted reproductive technology.
Okay.
So thanks to a lot of research and science, for women who have difficulty getting pregnant, we are trying every day to give more women opportunities to get pregnant using technology.
Okay.
And so there are various forms of it. And so I'm sure most of us heard recently where a 61-year-old woman got pregnant through, IVF, and then use of some stem cell transplant, because as a woman ages, your eggs or her ovaries also age.
Okay.
Unlike men, where every 3 months we kind of produce fresh sperms.
Okay.
Even
3 months.
Every 3 months.
Okay.
Even though as we grow as men, that's also our sperm still gets weaker. Compared to the woman, you are born with a finite number of eggs. So when you come into the world, you probably have like 1 million to 2 million eggs. By puberty, you are left with probably 300,000, because some of them die off. And then from puberty till you attain menopause, you release one of those 300 eggs every month during your ovulation.
Okay.
And so it gets to a time where if you are 48 years, it means your eggs are also 48 years old.
Okay.
So obviously with time, some undergo what we call atresia, and then they also lose their function.
Okay.
And so it gets to a point where the ovaries now don't function, so to speak, as good as they should, and then your menstrual cycle ceases.
Oh, okay.
And that is why women have menopause, and men don't necessarily have menopause or andropause, if you want to call it that way.
Okay. So for women, being able to become pregnant ends when your menstrual cycle also ceases.
That's the natural order of things. But thanks to technology, thanks to science, we are even able to get women who have gone past their reproductive age. That means gone beyond menopause, to still get pregnant through the use of technology. So we usually have to try and get eggs.
Okay.
Usually donor eggs.
So, somebody has to donate the egg.
Because at a certain age, we can't, because your eggs have all become arthritic or have undergone degeneration, we can't use your own eggs. So we then have to resort to donor eggs. So in the same way, even for some men, some men don't have sperm at all. They have a testis all right, they may ejaculate all right, but what people will call firing blanks. So I always tell people when they come to me, especially the women, when they say that thing they hear on TV that many being dana and sunaba. The fluid you see is not the sperm.
Okay.
So when a man has an ejaculation, what comes out is the semen. So the semen is a combination of the sperm, which is the cells themselves, which we, in our local language, we try to compare it to a tadpole. Okay, because it has a big head and a tail.
Sure.
So that is what compared to, and it comes in fluid. So your prostatic gland, your seminal vesicles, and all that release some fluid, which helps to keep those sperms alive till they are deposited in the vagina of a woman. And so the sperms swim up, and then some of the fluid can come out. So some people have that fluid coming, but it actually doesn't have any spermatozoa in them. So for people like that, you can even use donor sperm and then fertilize it with the woman's egg, and then the woman can get pregnant. And for those who are menopausal, yes, apart from the donor, you still also need to support them with hormones. So this time, instead of they producing those hormones naturally, we give them exogenous hormones in the form of injections to help sustain the baby till the baby is born.
Okay. This is going to be an interesting podcast. We are going to have a lot of interesting questions to ask you because a lot of questions are going through my mind right now, and not to actually move away from the discussion, but from time to time I'll be chipping them in.
No problem.
So let me, out of curiosity, ask, do we have offices or institutions really established to receive sperm donations?
Yes. So essentially, all the IVF centers in the country do receive some form of sperm donation. So they have sperm banks. The same way they also have banks where they store eggs. So they would normally, a few times you might see an advert where they are
really?
Requesting for.
How come I've never come across an advert like that?
In fact, because normally they want young, active, strong men. There's usually a joke that is the university student that they get. And of course, as a university student, you don't have money and they just ask you to come and deposit your sperm for some CDs.
How much is that?
You happily go. It would depend on where you are. But I'm sure you might get probably 500 to 1,000 CDs.
Per
donation. So that's probably not too bad. It can cover you for a week to probably a month, depending on how much you spend. But for egg donation, that usually costs higher because we can also harvest the eggs of young ladies and save for women who come at a stage in life where we can't use their own eggs and then use their eggs. But because they have to do more things, because we have to give you injections, we have to do a small surgical procedure to retrieve the eggs and then store the eggs. So since they have to go through more, they usually get paid a bit more than the men.
Okay, that's great. We will come back to that, but I want to find out from you, since you are the divisional chairperson for the Ghana Medical Association, how is it? How is the responsibility like being the chairperson?
Well, it's quite an enormous responsibility. Apart from the fact that geographically it's quite wide.
Okay.
You enter Western region when you get past Commander, so probably from Bepo, so that's Western region, all the way to all the safe areas, Akotombra, all that. So if you have to cover such a large area, and Western region is one of the big regions in Ghana, so it's quite a lot of work, and we have more than 300 members scattered all across. Usually, what makes it a bit difficult dealing with doctors is that, very well educated people, and so sometimes getting them to do things is a bit difficult, even getting them to attend programs and all that. A lot of doctors, we are not very comfortable people, but if you compare doctors to the general population, most doctors are quite well to do. A lot of them feel they don't have a lot of significant needs. And so when I say that in parentheses, unlike some people don't earn so much, don't have a lot of things doing, where if you call for association meeting, they are ready to come. Somebody may be doing locum somewhere or maybe looking for money somewhere, and so their focus will be on those things, which is going to rake some cash in than maybe coming to attend me. So usually getting doctors to attend meetings is a challenge. apart from the distance. Sometimes, and of course, some of them, it's not their fault, they're on duty and all that. So one of the biggest challenges is getting them to even attend meetings, and then getting them to push for some of the things. But generally, doctors love being part of Ghana Medical Association, and when real issues arise, I mean, we get a lot of people to contribute. But generally, because they are busy, sometimes from a leadership point of view, you feel like they are a bit apathetic. They are not showing a lot of, interest. But being busy, sometimes some feeling, they are okay. If there's no GMA, they'll be fine. And so that is why I say they are okay. They are well to do. So some of them feel, without GMA, they are still okay. As opposed to Health Service Workers Union or GRNMA, where they seem to be more vibrant and be doing more things. A lot of doctors are a bit laid back when it comes to GMA. But we still always have a core of people who show a lot of interest, and whenever we organize activities, they try to take part.
So building on that point, what is the mandate of the association in terms of your practice?
Okay, so essentially for GMA is not a regulator. Per se. American and Dental Council is the regulator of practice. GMA is essentially a trade union for doctors. Because we don't belong to Health Service Workers Union and all the other associations. So the GMA is the TUC for doctors. So when it comes to our remuneration, our compensation, allowance, all those things. That's why a lot of people think they only hear about GMA when there's strike or doctors are fighting for something. But internally, we also try to solve issues relating to our members. So let's say a member is taking ill, we have to step in and help. A member is facing challenges with other cadre of staff within their hospital, or even leadership in the hospital, we need to step in. Sometimes even when our members go wrong, we have to step in and then talk to our members. If we have to reprimand some of them, we have to reprimand them. Sometimes we have to tell them that, hey, you are not going the right direction. We've heard reports from here and there. If, let's say, a doctor is not doing too well, and then patients are complaining about a doctor, it is our mandate to, even before MDC decides, it gets out of hand for MDC to come in. When people report such issues to us, it is our mandate to step in, call the doctor to the side, and find out what the issues are. And if there's a need to help the person, we provide that help so that we protect the image of the association. Because we know that doctors are respected and we're a noble profession, and want to make sure that that standard is maintained forever, so that people don't take us for granted.
Dr. Vincent, on that point that you just mentioned, doctors are respected. It is a widely known notion, let me put it that way. And of course, growing up, when you go to the hospital, then a doctor is attending to you, this excitement and all that. And in the health sector, yes, doctors are well respected. Is that the case now?
Right.
Is it really the case?
Right. I would say that it has taken a hit. So it is not seen as before. And it's for me, it's for a couple of reasons. One, you see, when you get to see somebody more often, you tend not to see the person the way you previously see the person. And let me explain why. Previously, there were very few doctors. So to get the opportunity to even see a doctor, you had to struggle. I always tell people that as an Efiekuma boy, I never knew any doctor when I was growing up. Apart from the fact that I was born in the house, so I was not even born in the hospital. The few times where I was sick, I was taken to the hospital and I really didn't know what happened. All I knew was a nurse came to attend to me, gave me injections. Those days, chloroquine, your body would itch, and you have to sleep on those plastic mats so that you could rub your body. So I used to hear of a lot of doctors' names in typewriter, but I knew none of them. Because there were very few, and they were very busy, so it was difficult to see doctors. But now there are far more doctors than there were doctors 10, 15 years ago. Now more people even have doctors in their family. I remember when I was going to medical school, they used to say, if you don't have a doctor in your family, you won't get admission to medical school. That was the notion. It's not true because I didn't have a doctor in my family, but I'm a doctor. So it tells me that the net has been open, and a lot more people have friends who are doctors, have relatives who are doctors, have some even, sorry to say, have some SHS mates that they feel they didn't even respect them when they were in SS.
But
And then now they are doctors. So like at the end of the day, you are like, so it means being a doctor is not something wow.
Okay.
Meanwhile, those days, maybe a whole secondary school, maybe only one person out of that school get to medical school. And so by and large, there are lots more doctors. People interact with doctors more. Doctors have become more available. You can easily get access to them. And when that happens, usually the way you used to revere those people will kind of go down. So yes, it has taken a hit. But by and large, people still respect doctors.
Okay.
Still, doctors command a lot of respect wherever they go.
I asked that question because I want now to ask to talk about what I mentioned earlier, patient experience. Personally, how has it been with your patient coming to you? Especially that about 98% of your patients are females.
Yeah. So, I mean, when it comes to patient experience, for me, I have seen all the sites because I've worked for a little over 10 years now.
Okay.
And I always tell people that I'm one of the people, I mean, I know there are quite a number of us. I worked in a teaching hospital.
Okay.
I've worked in a district hospital. I've worked in the hinterlands. I worked in the city. So I kind of have seen everything. In the hinterlands where, quote unquote, you'll be seen like God. I mean, the patient comes and whatever you say, the patient will say yes. And then in the city where patient has read before coming and will want to challenge you, want to bring their point of view. Maybe challenge is not the problem, but they want to bring their point of view based on what they have read. But yes, you still find a few people who probably even think they know more than you, the practitioner, because of what they have read. Google. So Google is their doctor.
Yeah.
But one of the things our medical practice is that it's not everything that's on Google.
Okay.
You may look online and may still make mistakes. So I've had patients that are a bit difficult to handle. And sometimes you have to calm down and then talk to them and see reason with the patient. And always understand that the person is probably frustrated because of the disease or whatever challenge the person is facing. And the person wants a solution. That's why the person has come to you. And we are all human beings. Just as some doctors may not have the greatest of attitudes, the same way some patients may not also have the greatest of attitudes. Yeah. So they may come probably in a very forceful or, I don't know whether vociferous is the right word, but they may come, some may be shouting, some may be screaming, some may even think, yes, you are not giving sometimes it may not even directly the patient, but the relative may feel you are not giving their relative the urgent attention the relative needs. So you may find some people not too happy with you. I haven't had too many of that, but I have seen a few. So I have had all the experiences, but I think generally most of the patients that come to me are quite respectful and quite
because I wonder, looking at how prestigious we hold on to our doctors, what will make patients attack health? Let me put it that way. Let me not focus on doctors. What will make patient or their relative really become aggressive and attack a healthcare provider or a healthcare worker?
Yeah. I think it's usually because of lack of communication and sometimes lack of understanding. So let me start with the lack of communication. We are human beings, so I will not hold brief for healthcare practitioners because sometimes I think instead of communicating to the relatives, bringing them up to speed with whatever they are doing, some of them keep the patients and the patient relatives a bit in the dark. And as a result, the patients get angry and feel they're not receiving the care that they are receiving. Let me cite an instance. Recently, I had to deal with a situation. I was not there, but I was called. So this patient was seen, and medications had been requested. But instead of the doctor going to tell the relative or instructing the nurse to the relative that, we've seen this, your relative, and have prescribed medication, so go to the pharmacy and go and pick the medication, they started attending to another patient. Okay. Or another patient was brought in. So in the heat of the moment, it kind of escaped them that they had already finished seeing this patient. So the patient and the patient relative were there for more than 30 minutes. And the patient was in pain. And to them, the patient had not been seen. And they go upset, created a scene, wanted to take the patient away. So I was called by a third person. So I had to call the doctor on grounds and then find out what was happening. He said, "Oh, the patient. We've already seen the patient. We've already prescribed medications and all that. So it's just for the relative to go and pick the medications." So I told the doctor, "Yes, but even if you had another emergency, I don't think it would have taken you more than 5 seconds to just tell the relative that medications have been prescribed. So just go to the pharmacy and pick the medications. Yes, you had an emergency and probably that is what made you leave." So sometimes it is those circumstances. Sometimes I see some of the videos that go on social media, and sometimes people think that, okay, if I brought my relative who is sick, and nurse should be standing by the patient 24/7. It doesn't work that way. So sometimes I see videos and they say, "Oh, patients that are hot and there's nobody attending to them." If they have already been seen and medications have been given and let's say an infusion is running, in Ghana, the patient to health worker ratio is very low. You don't expect that the nurse or the doctor will pick a chair and sit by your patient waiting for the whole infusion to run. So they will leave the patient, attend to another patient, and intermittently they will come and have a look. Lack of understanding. Let me use another example. I always ask people who are non-medical practitioners that if you go to an accident scene and you see 2 people lying there, one is screaming, "Muruwo, Muruwo, Muruwo," and another person is lying there quiet, who will you attend to first?
Well, I would definitely go for the one that is quiet.
That is quiet. Yes. Maybe because you have been in the health system a bit. But I'm sure majority of people will say that let's go and attend to the one shouting Muruwo. Because he's shouting Muruwo, so you would think that that person is more ill than the one who is lying quietly. But a health worker will attend to the person who is lying more quietly, because it means the person probably has his airway or her airway is probably even blocked. For the person to even shout Muruwo. If you're able to shout Muruwo, I have already made 3 diagnoses. Your airway is patent. You are breathing. And likely you have a good circulation. That is why you're able to shout Muruwo. That means that I have tried you and I know you are not going to die. You are not going to die in the next 10 to 30 minutes. But the one who is quiet is probably the one who needs attention. And sometimes that's what happens in the hospital. People bring their patients and think that their patient is the one going to die first. And so you should attend to them first. In a hospital setting, it is not first come, first serve. We do triaging because we have to attend to the one who is likely to die first and not who came first. So if you came 2 hours ago and somebody comes and that person is likely to die in 10 minutes time, we don't care whether you came 2 hours ago. We'll have to attend to the one who came 10 minutes ago because the person is likely to die faster than you. And that is what the principle of triaging is about. So it's not first come, first serve. It's who is likely to die first. And let me just chip in this. Unfortunately, when these things happen in our setting, people get upset, and our colleagues, even in the diaspora, make it worse, trying to talk about how Ghana's system is bad and all those things. But you see, some of us are privileged to have worked or have been in clinical settings in overseas countries, both in Europe and in America. And I have had a friend go to an emergency in the United States. And he sat there for 6 hours and was not attended to, and he had to call me on phone that from Ghana that I should prescribe something for him to go and take because he's been here for 6 hours and has not been attended to. So this is not something that is peculiar to Ghana. It is something that is proper medical practice worldwide. Because we need to triage and attend to who is likely to die first. And then so when you go to a typical emergency unit, bands are put on people's hands. Red, yellow, orange, green. So if you have a green band, you are not a priority. We can wait to see you a bit later. If a red person comes, the red person takes preeminence over you. And sometimes this causes confusion because people bring in their patients and think that every other thing should stop for them to be taken care of. But like I said, sometimes health workers don't also do their best, because I won't, because I'm a doctor, say we are always right. Yes, we are human beings. Some of our people may not do their work the way it's supposed to be, but usually it's as a result of either lack of communication and lack of understanding.
So just as we I had Dr. Ishan here some time ago, and it's similar to what he said. So I see that there should be some form of education. Whose responsibility is it to educate the public in this regard?
Yeah. I think it's a collective responsibility from the ministry, Ghana Health Service, CHAG,
Okay.
everyone. You know, ideally, in fact, I was at a meeting yesterday, and one of the things that came up, you know, when we go to a lot of the hospitals, there are TV screens there, and sometimes the news will be showing, sometimes movies and all that. But those screens should be mediums of communication.
Okay.
We should be able to use those mediums to communicate to people. So something like this triage, something like education on hypertension and all those things. We should be able to put all those things on screen for people to listen as they sit and wait. And as this education goes on, people would understand. There need to be more adverts on TV, or at least more education on TV. When people come and sit, health workers should be able to stand up and then educate the public while they are waiting to see the doctors. So as this education goes on more and more, people get to understand. Let me also add that there's something we call the patient charter, which I'm sure a lot of people have never read.
Sure.
So you can just go on the internet and Google patient's charter.
Okay.
This is something that came out or was brought up by the Ghana Health Service. I think the last time they did something about it was around 2012. And it talks about the patient's rights. And as we all know, rights go with responsibilities. So it lists the rights that the patient has. You need to be taken care of by the doctor in a humane way. You should not be discriminated against based on your tribe, your religion, etc. The health worker needs to, be respectful towards you. Needs to take care of you in a prompt manner. You have the right to receive all the information you need, to be given options as to how you should be managed. All those things are listed there.
Okay.
And then the responsibility of the patient is also listed there.
Okay.
Because as a people, we are happy to know our rights, but everybody wants to shun away from responsibility. So we go to hospital and want to, I know my rights. But you also have a responsibility to be respectful towards the health worker. You have a responsibility to even tell the truth to the health worker. In fact, that's one of the things that sometimes even Ghanaian patients fall short. They have had the symptoms for 3 months, but they know if they can't tell you 3 months, your reaction may be different, or you may not take care of them in a certain way. So they'll come and tell you it is 1 month. I've even had patients who have blatantly told me lies about the duration of their symptoms, just because they were told in the house that, for instance, if it's fertility, 4 years, if your doctor not for serious, 7 years. That is a lie, and it flouts your responsibility of being truthful to the health worker and treating the health worker also with respect. So we are happy to know the right, but we want to run away from the responsibility. So I think that we should all be made aware of this patient charter. Everybody should read it. So when you go to the hospital, you know what rights you have as a patient and what responsibility you also have towards the health workers.
Okay. Ghana health sector. I know the ministry is doing very well with improving our access to health. Now, previous government introduced the Agenda 111, built hospitals all over. We may not be able to, or let me say, some of them are not operating now. But I'm also much aware of the public health initiative where health centers are being put at deprived areas to make all these are to improve access. The government is making huge investment in this regard, yet we are not seeing top. What is going wrong?
Yeah.
Generally, what do you think is going wrong?
Yeah. See, when it comes to healthcare and generally development, see, it's a holistic approach. The same way you can't send healthcare workers to a place where there's nothing for them to work with, you can't also put up facilities and not have the staff to man it.
Okay.
See, it brings us back to a lot of healthcare workers at home, especially nurses and even doctors. These days, when you finish your house job, you can stay home for over a year before you get posted at home. And then the facilities are set up. Who is going to man those facilities? And then, even as we are trying to improve access by pushing health centers and all those things to the hinterlands, to make sure that even the farthest and remotest of people get some form of healthcare, are we sending staff there? The staff that are going there, are we tooling them properly? Are we giving them the things they need? Are we ensuring there's a good means of transport for them to get there? I mean, I know Rome was not built in a day, so we can't get there in a day. But it should not just be the show, which is something that Ghana, we are very good at.
Okay.
Doing policy, launching programs, and sending cameras to show. Just like you mentioned Agenda 111, there was a lot of camera around.
Yeah.
But later we realized a lot were not complete and there were so many issues. The same way we started launch this primary healthcare. Lots of going around, lots of cutting of swords, lots of pictures, lots of motorcycles and all those things. We don't want it to end with the show. We want it to get to where it's supposed to get to. We want staff to be sent there. We want the staff going there to be tooled properly. We want the staff there going, don't go and sit there for 3, 4, 6 months. Salary is not coming. They are upset and they have to now go on demonstration. You see, it should be a holistic approach. We should make sure that what they need to make their lives better are given to them. The place is set up well with all the necessary things they need so that they can do the work well.
Okay.
Because we see we can do so much without what we need. And we don't want to be the workman that will be said we are quarreling with our tools. We want to have the right tools so that we don't have to quarrel with them. But we can work amicably with our tools, the system, the societal support, good transportation, and all that. Because you send somebody somewhere and they can't even get a means of transport, and there's a patient that they even need to refer, they can't move, and then we end up having the mortalities that we want to avoid. So it should be a holistic approach, and should not just remain with policies, launch, cutting of swords. We want to practically see that things are being put there, they are being operationalized, staff are being sent, their salaries are not delayed, they are being compensated. Okay. And then we can do the usual thing that we do with project, monitoring and evaluation. Go evaluate, let's see whether the things we have sent are making the right impact. Get feedback, and then if we need to readjust or change some things, tweak it so that we can get a maximum result, we do it. But a lot of the time, it ends with launch, pomp and pageantry, cutting of swords, sending cameras. But if you go on the ground, things are not the same.
Okay, thank you so much. This has been an exciting discussion and an educative one too. Convo with Champions, it's all aspects of life, and for the health sector, doctors, nurses, pharmacists, allied health professionals are doing so well to help with our community development, etc. It is my hope that this information we have shared on this platform get to where it needs to get to. I think that the Ghanaian health sector can be better and will be better if leaders put in extra effort to the policies that they themselves bring up for implementation. It's all about commitment, and I feel that when we put in our best, instead of politicizing most of the things that goes around, our health sector will become the best in the world. Yes. So thank you for watching. This has been Convo with the Champions, and today I had Dr. Vincent with me here on the show. Don't forget to subscribe, like, comment, share, and of course, we'll meet again next time. Bye.